Many pastoralist communities prefer to have many children in order to increase the probability of their survival. Since there is no child spacing for 2 years, for example, children don't get the recommended 6-month exclusive breastfeeding they need.
I mean, culturally, a father would have a number of wives, and each wife would have a number of children, because to increase the rate of survivability, you would have maybe 10, maybe 4 or 5 would succumb, then 5 would survive. But where we are today is fairly better than how it was before. You can see the nursery enrollment has increased, class 1 has increased tremendously. So that's already a proxy indicator that survivability rate has improved.
Faith communities have appropriate scriptures which support child spacing and consequently natural family planning.
For example, family planning. You could not mention that word. The moment you mention family planning, the Muslim people walk away. But we told them, when they read that there is what we call family spacing, they started accepting. And they also read from the scripture.
Access to health facilities in the arid and semi-arid areas is still a big challenge to most communities. 52% of Kenyans live over 5 kilometers from the nearest health center or trained health worker. And for those living in the country's most remote areas, the distances are often far greater. As a result, many expectant women still give birth at home using traditional birth attendants, often leading to loss of life as a result of pregnancy-related complications. The partnership with Religions for Peace and UNICEF provides religious leaders with resources to help their churches, mosques, and temples and places of worship to encourage pregnant women to attend antenatal clinics and give birth at these health facilities. They also encourage men to be involved by supporting and accompanying the mothers to attend clinics. ANC visits and skilled deliveries greatly enhance the survival rates of children, since danger signs can be monitored and the qualified health personnel are on hand to handle any emergency.
Zamani Wasamburu wako wanaenda kliniki na walikuwa wanapoteza sana. Mara mtu anapata mimba, mtoto anakaa kama mwezi 4-5 inatoka haendi kliniki. Hata mama akijifungua nyumbani hawezi enda kliniki. Hata hawezi pata lile shindano BCG, mtoto apeleke kabisa kliniki. Lakini siku hizi tumeona umuhimu kwa sababu wamama hata wamanyeta kabisa. Wenye hata hawajasoma unakuta wako kliniki kabisa, ndio wako frontline akija kliniki. Hata siku hizi vile tumepata maternity hawajifungui nyumbani. Hata kama mama anaishi juu ya ile milima, akisikia tu ameanza kuumana anakuja mpaka kliniki, mpaka hospitali. Tumeona kabisa umuhimu kwa sababu hata vifo vya watoto zimepungua kabisa hapa kwetu.
What we are most grateful and happy about also working with the religious leaders and seeing their commitment to this project, but most importantly the commitment of the county governments to work with us to make sure that the budgetary allocations are changed to reflect the needs on the ground, and also the social sector heads, their sensitivities to work with us, and also the community health workers and community health volunteers to ensure that this project creates the impact that is important.